I'm Dr. Timothy Johnston with your post-op video for dental crowns. If you had a crown, then you know you got very numb, and we did a preparation where we got the tooth ready for a crown that's going to encompass the tooth or enclose the tooth and make it structurally stronger. Here's what you need to know about today and the next week or two. Today, when you got numb, the injection site may end up being a little bit sore because we put a needle there, so don't be surprised by that if the gums are a little bit sore. If they get really swollen, let us know. May have a little hematoma or something there, might need to be on some antibiotics for it, although that's unusual. It can happen. Your gums are also likely going to be a little bit sore. In order for us to capture a detailed impression, we always use something to get the gums out of the way. That may be retraction cord or a laser or even something called a radiosurge or electrosurge. All those things are going to leave your gums just a little bit irritated. Usually goes away within a couple of days, so don't be too concerned about that. Teeth that have just been worked on, whether it's for a filling or a crown or anything, tend to be a little bit more sensitive to hot and cold for a couple of days. So again, don't be too concerned, but if it gets extreme, we'd like to hear about it as soon as you start to experience that. Once you've left the office, you have a temporary crown on your tooth. Remember that temporary crown is made of plastic and it's held in with a temporary or weak cement. So because it's plastic, it's a little bit weaker than your typical crown is going to be. So be careful chewing on really solid things. You want to avoid almonds or Doritos or peanut brittle, crazy stuff like that. Just go easy. Also, because it's held in with a weaker than normal cement, temporary cement, it comes off easy. It's designed to so that we can get it off at your next appointment. So also want to go easy, not chew anything like caramels or Tootsie Rolls or just even chewing gum can pull that right off. So be extra cautious about sticky foods. If the temporary does come off and you can figure out how it goes back on, go ahead and stick it back in place and then give us a call. It's really important that your temporary stay in place. If it's out for a few hours, no big deal. But if it's going to be out for 2 or 3 days, you might say, well, it's not sensitive anymore. It's not bothering me. I'll just leave it out till my appointment. That would be the wrong thing to do, however. The teeth nearby are going to shift and even close off the space somewhat so that the new crown we had made no longer fits. We've got to go through a new impression and have a new crown made. So if it comes off, put it back on and give us a call. If you can't figure it out, don't worry, give us a call anyway. We'll have you come right back in. If you happen to be out of town or can't get a hold of somebody, one of the best ways you can hold it in for a few days at a time is to pick up a little denture adhesive cream from any pharmacy or even any grocery store. So again, denture adhesive cream or denture adhesive paste like Fixodent, for example. Stick a little dab of that inside, squish it back down on, and that usually holds it for a couple of days. Again, most people don't have any of the complications I've just described, but if you do, we'd like to hear from you so that we can help correct it. Thanks for watching.